All right. So we have talked about the foods that increase LDL cholesterol. But again, it's not just about telling patients what they shouldn't eat. What we really want to do is tell them what they should eat. So the other side of the coin is the foods that decrease cholesterol. So let's walk through those. To explain this and to put us all in the same frame of mind, let's talk about the benchmarks just to remind everybody for cholesterol. So basically, we say that less than 100 milligrams per deciliter is optimal, 100 to 160 is elevated, and 160 is high, right? Now, if you ask some people, they'll tell you, actually, ideal is 50 to 70. That's a debatable thing. We don't have to get into it. But these are the benchmarks we're thinking about. And the average cholesterol, LDL cholesterol level in American adults is 116 milligrams per deciliter. So for the next few slides, I'm going to use 116 as the benchmark that I'm doing my calculations based off of, just so you guys understand, because obviously percent reductions are relative to where you're starting. So the first food that I want to talk about that decreases cholesterol is nuts. So this is a meta-analysis of 61 randomized controlled trials. Okay, this is not like one little study out there. 61 randomized controlled trials show that on average, if you eat one handful of nuts or about a quarter of a cup, it will decrease your LDL cholesterol by 5 milligrams per deciliter, or about 4%. So that's kind of a modest amount, right? But it's also something, and it's not that hard to eat a handful of nuts per day. But what's interesting is if you look at the dose response meta-analysis. So you take all those studies, plot them. Along the x-axis, you have the number of grams of nuts per day, and then you have your cholesterol reduction. What you can see is that as you increase your nut consumption, your cholesterol levels tend to go down. And in fact, if you eat 100 grams or 1 cup of almonds per day, you decrease LDL cholesterol by 33 milligrams per deciliter, or 30%. That's pretty impressive if you consider that rosuvastatin had a dose of 10 milligrams, decreases LDL by about 45%. So I think that's pretty good. But then, of course, you have to ask yourself, well, I mean, 1 cup of almonds, that kind of feels like a lot. This is 1 cup of almonds on a plate. I think depending on the person, it's achievable. If you're like me, I also counted it out. It's 166 almonds, which looks like this. The other question is always like, is this like economically feasible? Nuts are expensive. So I kind of went shopping around Norfolk to price almonds in different stores and to get a price comparison on how much food costs for reducing cholesterol versus medications. So basically, if you want to eat 1 cup of almonds every day to reduce your cholesterol, your LDL cholesterol, it will cost you about $40 to $72 per month. This is based on like Aldi and Harris Teeter and Food Lion. Aldi had the cheapest price, Harris Teeter had the most expensive price, Food Lion was somewhere in the middle. But if you compare that to the prices I got from GoodRx, your statin is going to cost you $54 to $146 per month. So interestingly, almonds are a cheaper way to lower your LDL cholesterol compared to rosuvastatin, although you probably can't claim the almonds on your insurance, so that's a problem. How do nuts actually lower cholesterol? This is interesting too. So part of the reason nuts lower cholesterol is because they contain MUFA fats, which we've already talked about as being, oh, I didn't animate that. MUFA fats, so technically almonds and nuts can also be in that group. I didn't include them initially. The other thing is they contain these things called phytosterols or plant sterols. So phytosterols are plant-derived compounds that look a lot like cholesterol. As you can see here, this is the phytosterol, that's the cholesterol. They look the same, right? And then the body also can't detect the difference between them, and they compete for absorption, and they decrease your absorption of cholesterol. Because keep in mind, every day your cholesterol is getting processed through your liver. It's sliding down what I like to call the bile duct slide into the intestines, and you want to excrete that cholesterol. But if there's opportunities for it to be reabsorbed, it gets reabsorbed, but having more of these things around prevent that from happening and prevent it to be on its way out of the body. This is for the question that we had earlier. So the other way that nuts lower cholesterol is because they contain what's called soluble fiber. So let's talk about now the dietary fiber family tree. So there are 2 main types of dietary fiber. There is insoluble fiber, which is characterized by the fact that it does not dissolve in water. And then there is soluble fiber, which dissolves in water. And we know that, as we talked about before, the soluble fibers, you eat them, they dissolve in the water in your intestines, they form that gel. That gel traps things like sugar. It also traps things like cholesterol. But, so you get your insoluble fiber there's different types like cellulose, which you get from fruits and vegetables, hemicellulose, which you get from like nuts and legumes, lignins, which you can get from tree bark. But then there's these soluble fibers, right? And they're the ones that form the gels, and they're the ones that trap sugars and trap cholesterol. There's many different types of soluble fibers, but a few of the ones I'm going to be talking about are beta-glucans and pectins and psyllium. You'll hear more about these in a moment. So psyllium fiber, this is a meta-analysis, 28 randomized controlled trials, showed that if you eat 2 teaspoons of psyllium fiber per day, you decrease your LDL by 13. That's a 11% reduction. Oats are a dietary source of beta-glucans. So beta-glucans are a type of soluble fiber. This is a meta-analysis of 58 trials, and they showed that if you eat 1 cup of oats per day, you can lower LDL cholesterol by 7, which is about a 6% reduction. Barley, another very rich source of beta-glucans. This is actually just based off 1 trial. Barley hasn't gotten the research that it deserves, but 3/4 of a cup of barley decreases LDL cholesterol by about 17 milligrams per deciliter and by about 15% in total. Beans, legumes, pulses, whatever you want to call them, meta-analysis, 26 randomized controlled trials showed that you decrease LDL cholesterol by 7 milligrams per deciliter, which is about 6%. And then flax seeds, our friends from our hypertension talk, 4 tablespoons per day decreases LDL by 3 or about 2.5%. So not a huge amount, but by the way, meta-analysis, 28 controlled trials, so lots of data. Even though flax seeds alone don't have a huge effect, this is a study that really caught my attention because this is a study where they compared prescribing someone a statin alone versus prescribing them a statin and flax seeds. And what they showed is that when you added flax seeds to your prescription, their LDL went down by an additional 11.5% compared to statins alone. So once again, it's not a question of diet or drugs. It's a question of like using these things together for the best possible benefit. This is very interesting. So this is a Cochrane review looking at fruit and vegetable consumption and effects on LDL cholesterol. And what they showed is that if you eat 5 to 9 servings of fruits and vegetables per day, it really doesn't do much for your cholesterol. And I like to show this because I find that even I myself get caught in the trap of making like generic nutrition recommendations to patients, like eat more fruits and vegetables, which is always the right thing to say, unless you're specifically having a conversation about cholesterol, in which case telling people to eat more fruits and vegetables per day actually doesn't move the needle at all. It will decrease their risk for all-cause mortality, though, so you're not doing them any harm. That being said, we talked before about the different fibers. Apples are very high in pectin, which is a soluble fiber, and research shows 1 randomized controlled trial, but still, 2 apples per day decrease LDL cholesterol by 7, which is about 6%. So, and that's because they contain pectin. So there's a lot of foods that you can add to the diet to lower LDL. Here they are all stacked up. Barley, it was only 1 trial, so again, not as robust data. Barley tops it off with a 15% reduction. Your Metamucil, your beans, oats, apples, nuts, and flax seeds. But the thing I want to impress upon you is for these foods, the only thing we're doing is adding this food to the diet, right? We're not doing anything else. We're not telling them to take anything else out. We're not telling them to change their diet. We're just telling them to add something. But what if we did change something? Later. What if we did change something? What if we swapped foods? What if we swapped olive oil for butter? What if we swapped soy burgers for beef burgers? Then how do cholesterol levels change? This is a study where they did that. They swapped 3 tablespoons of butter per day for olive oil. And by making this swap, they decreased LDL cholesterol by 15, which is a 12% reduction. And this is a study where they had people eating a lot of animal protein and soy protein, 47 grams per day, where they showed that if you swap your animal protein for soy protein, you decrease LDL by 22 milligrams per day, which is a 19% reduction. But again, I just want to point out, it was a good amount. So like they were then eating about a soy protein patty, a cup of tofu, and soy milk every day. So like high amounts of these soy products. So obviously, there's a lot of individual things that you can do to lower cholesterol. But the question is, could these effects be additive? What if you did all of these things? Would you get a maximal reduction? Would it all add up and you would bring it down by, a huge amount? There's actually a study that tested this. So there is this diet, it's called the portfolio diet. And the portfolio diet is all about giving people a portfolio of foods to lower their cholesterol. Once again, it was invented at the University of Toronto. This is me with the inventor of the portfolio diet. It was invented at St. Michael's Hospital, which is the hospital where I did my clerkship, shown right here. And the Portfolio diet basically looks like this. They're eating 45 grams of nuts per day. That's about a handful to 2 handfuls. Plant protein, biscuits or sticky fiber, which is those soluble fibers. And they're eating plant sterols every day. And this was a study published in JAMA in 2011. And what they showed is that the control is like the top line. The Portfolio diet reduced cholesterol as much as, at that time they used pravastatin was like the going drug. So it reduced cholesterol as much as pravastatin. So that's pretty impressive because it shows that if you put all these foods together, the effects are additive. They're not gonna you're not gonna max out like if you have the apple and the oats, like it tops out. No, it doesn't. They add and your cholesterol gets lower and lower. And if you're interested in hard outcomes, the Women's Health Initiative showed that if you eat the Portfolio diet, it does decrease risk for coronary events. So it's not just a cholesterol lowering effect. We're not just changing the marker of disease, we are changing the actual disease outcome itself. So what do we tell our patients? This is another guide that I made after I arrived here, giving people very simple things that they can do to lower their cholesterol levels. So it's individual actions. Again, you could pick one and say, which one of these things do you think you could add to your diet? Or which one of these things do you think you could change? I'm still working on this. I think I'm going to reinvent it. But for now, this is one that I've been using that you can use too if you're interested.